just thinking about letting people in, but presumably Kitty's going to let people in. Yep, people are joining. Good evening, everybody. Thank you very much for joining. We'll let a few more people join in. Okay, so let's get started and ask, please, for anyone that is with us live now, if you have any questions that arise in your minds as we go through our talk on comparing, please pop them into the Q&A and we'll do our best to try and answer those questions.
Yeah. Good. So my name is David Veale, and I'm a consultant psychiatrist in cognitive behavioural psychotherapy and a visiting professor at the King's College London, and I'm based at the South London Maudsley Trust and currently at the Nightingale Hospital. And my colleague Rob.
Hi, I'm Rob Willson. I'm a specialist cognitive behaviour therapist and also, of course, the chair of BDD Foundation.
Great. So Rob and I thought we would do today a topic on comparing, because we know how common it is in BDD. We thought that it would be helpful to unpack it a bit and think a little bit about what it is, what motivates it, and how perhaps we can start to think about how to stop it. So let's have a go. So we're going to start with our understanding of BDD, and that is that many people with BDD have a felt impression of how they feel, how they believe that they come across to others. And so here, this is someone who has on my left, yes, before treatment and then after treatment. And you can see how the size of his nose and other features have changed. And so this is what we're saying, is that his appearance has not changed, but his felt impression, his body image has changed during treatment. And we think that this felt impression, how you think you're coming across, is a terribly important part of BDD. And we call this the concept of a self as an aesthetic object. That is the way that you believe that you're very self-conscious, that people are looking at you. And this particular person feels as if they're a walking nose, because that felt impression of his nose is really defining his self. Yeah. So this is the model, and that is that individuals with BDD tend to have these idealized values about the importance of appearance in defining the self through the way they feel about their defect. And here is, it's almost like, I am my nose. Now, the next thing is this, therefore, these extreme self-consciousness and self-focused attention on that constructed body image, which has become fused with reality. In other words, you're very much looking inwards and seeing how this felt impression of one's appearance. And what we've increasingly noticed that there's a lot of uncertainty and sometimes instability about the body image. There may be certainty about how you evaluate yourself and believing you're ugly or whatever, but there's often uncertainty about how you feel that particular body image that I've been talking about. They're usually motivated to avoid being rejected or humiliated perhaps because of past experiences, which may be memories that are extremely distressing. And so whilst this is all going on, you're trying to cope. And so what you're doing is this constant comparing, ruminating, trying to monitor exactly how you look on that attentional bias, constant checking and reflective surfaces, trying to camouflage yourself and avoid being triggered by being in particular situations or activities. And what we're going to focus on in a moment is that way of coping of comparing. And let's start with a popular sketch. Well, it was popular for me and Rob when we were younger, or young men. But it brings to, I think, comparing to light.
I look down on him because I am upper class. I look up to him because he is upper class. But I look down on him because he is lower class. I am middle class. I know my place. I look up to them both. But I don't look up to him as much as I look up to him. Because he has got innate breeding. I have got innate breeding, but I have not got any money. So sometimes I look up to him. I still look up to him, because although I have money, I am vulgar. But I'm not as vulgar as him, so I still look down on him. I know my place. I look up to them both. But while I'm poor, I'm industrious, honest and trustworthy. Had I the inclination, I could look down on them. But I don't. We all know our place, but what do we get out of it? I get a feeling of superiority over them. I get a feeling of inferiority from him, but a feeling of superiority over him. I get a pain in the back of my neck.
Lovely. Okay, so that was, oops. Okay, so let's try and think about unpacking what is going on here in this comparing. And this has actually been looked at in a paper by Marina and so on in 2023. So the key thing to understand is about this comparing, it's a process which may be either aversive, and that's, unpleasant, or gratifying. It's often automatic and involuntary, and we're focusing obviously today on the appearance-related comparing, but as you can see, other people might be comparing socially, where they stand in life, or it might be to do with how competent they are at something. So we're going to focus on appearance, and it could be social comparison. In other words, you're upward comparing, where you make yourself feel worse, where the middle class person was comparing to the upper class person. It could be downward comparing, where you make yourself feel better, because like the middle class person was looking down at the working class person. Or it could be lateral comparing, where you're just comparing yourself against the similar. It could be temporal comparison. In other words, here with comparence, it's about compared to how I used to look in the past, or how I could look. So that might be before perhaps a cosmetic procedure, or how I could look in the future with a prospective cosmetic procedure, a planned one. It could be what's called counterfactual. If only I looked like such and such. If only others had behaved differently in the past. Yeah. So this is the sort of fantasy type ruminating, comparing. Then there's what they've referred to as criterion-based comparing, how I expected to look if they had, done this procedure correctly or whatever. And a dimensional type of comparing, where perhaps, okay, I look ugly, but I've got other attributes apart from myself that compensate in some way. Yeah. So, you might think about, well, what sort of comparing am I doing? Mainly, what's the main percentage, taken up by these different types of comparing? So what we do know is that appearance comparing is extremely common process in BDD. And we've looked at this once in a paper by my colleague Martin Anson, and looked at the frequency of it in BDD. I mean, it's quite common in the general population, but it's just much more common in BDD. And what's going on is that individuals with BDD are comparing a specific features compared to their overall appearance. And that's going to make your attention bias worse. In other words, if you're constantly comparing your nose or your skin or whatever, it makes you more biased in your attention, and therefore it tends to magnify it even more. More time is spent thinking about one's appearance, and that just adds to the preoccupation. Satisfaction is worse after comparing, which is nearly always upward comparing, and that just adds to the distress. And social media, of course, is especially problematic because lots of many images to compare against, and particularly against a particular feature that you don't like. So very common in BDD. And there are all sorts of unintended consequences of that comparing. In other words, we're going to try and understand the motivation shortly, but after you compare it, of course, we were saying it increases your preoccupation, it contributes to that self-focused attention, which makes you more aware of your appearance. It strengthens the attention on specific features, resulting in heightened awareness of that defect. It then reduces confidence in how exactly you do look, because that's one of the things you might be looking for. It contributes to that biased view of your appearance of others and this very unrealistic ideal. It reduces connection in social situations because you can't connect to people very easily if you're constantly comparing a feature. And it just feeds the overthinking, the checking, avoidance and safety-seeking behaviours, just to check exactly how you look or trying to camouflage a perceived defect and so on. So, there are all sorts of consequences that just makes it worse. So why, what's the motivation for comparing? And again, this is something that Robert looked at partly in his PhD. And it seems to, in the short term, increase uncertainty about how they look. So the motivation people say is, so I can be clear about what's wrong with my appearance. Yeah, that might be, driven by that sense of uncertainty of exactly how you do look. It may help to confirm your beliefs about your appearance, so I don't forget how ugly I am, as if somehow you're going to forget. Yeah. It keeps yourself perhaps safe from rejection and humiliation, so I know my place. You remember that working class person was saying, I know my place. So you don't, I'm not going to get rejected and humiliated. It might be a motivation to improve my appearance. I can work out how I might improve it or conceal my flaws. And it's a habit, It may be difficult to understand the motivation. It may have started off with one or more of those motivations we've just been discussing, but it just becomes something that you just do so automatically. You're sort of not aware of it most of the time. And it may just be difficult to understand, especially after so many years of doing it so automatically. So it's difficult. Worth thinking about, can comparing ever be helpful? Well, I'm thinking perhaps, one of the things that happens of course, in animals, you can see, is it may help decrease conflict. Because, when I know my place, you can see the sort of puppy dog roll over, and it means that it's reducing the risk of conflict or aggression in the mammals, where, you're keeping yourself submissive and subdued because you know your place and you're not going to be a threat to the person who is threatening you. I think sometimes if you get that temporal downward comparisons, particularly perhaps say where you've got an athletic performance, you're comparing yourself against a previous performance and it's trying to motivate you to beat yourself in some way in the timing or whatever. And it can be motivating about something you want to achieve. I think it's safe if it doesn't define you. In other words, you are not, of course, that feature, and it doesn't define the particular individual. And therefore, if you're comparing something, let's say back to the nose or skin or something, it's just one part of you. It's not the whole of you. And it's okay if it's not a demand. It's just an inspirational role model to help your progress. That you'd like to be something that they have achieved or whatever. It's an inspiration, but it's not a demand that you have to be on that particular way. So, you can think of situations where it could be helpful in the short term as such. So, Rob, you're going to talk now about perhaps some ideas we got on how to stop comparing. Over to you.
Thank you, David. Yes, absolutely. So this is the real trick, and as David said, it oftentimes people find that after a certain period of time, their tendency to compare has become quite automatic. It's become part of your habit system. And of course, habit system is really helpful if you don't want to forget how to walk or how to drive a car and things. And it's really good that your brain can do things on autopilot. But what our brain isn't very good at is discriminating between habits that are good for us and maybe habits that aren't so helpful to us. And so I would definitely say it can be helpful to look at the costs and benefits of comparing for yourself and see if you can galvanize yourself to resist comparing and try and understand a bit about your motivations. But oftentimes, as David has said, they can become maybe a bit lost in time because you've had it for so long, you've done it for so long, and it's just become something you do automatically. So with that in mind, it becomes quite important to try and understand the anatomy of your comparing in BDD. So which body parts are you comparing against your body against other people's, maybe, or in real life, TV against social media and other images, and so on. Who are you comparing against? Which kinds of people? Is it also your past self that you're comparing against? Or is it against an ideal that you've got in your mind? But also important to understand, where do you compare? Is it particular kinds of social situations? For a lot of people, it can be about particular kinds of, obviously, gender, or and it can be a certain age and things that people are more likely to compare against. But it might also be that there are certain hotspots like clubs and pubs, maybe, or restaurants, or more than maybe out in the street. Or some people might notice that when they're into school or something, that's when it particularly switches on. And the reason it's important to understand kind of when and where it happens is to understand kind of when do you need to be galvanizing yourself and really trying to prepare your mind to work against comparing. Because the more you can see it coming, the more you can prepare and try and think about where else you're going to focus your attention and things. So trying to understand, are you in these situations, are you self-focused, and trying to get this understanding of how often you compare. And I often find myself in therapy sessions doing this, which I regard as an international hand sign for tally counter, because using something like a tally counter to record the frequency of your comparing will help you to become more aware of it. It'll help you to become hopefully more motivated to start to reduce it, because you see the numbers, and oftentimes people are quite surprised at when they do the frequency recording for say a week, how often they're comparing. And then oftentimes you can use the tally counter as a measure of your success, because over time you keep recording as you make efforts to try and combat it and fight against it. You can try and hopefully see those numbers come down, and you keep recording, and it's a nice bit of feedback that you're actually reducing the frequency you're comparing, and hopefully that will become a very positive input into your overall recovery. And again, and so hopefully the more you do this, the more you become aware of it, the more you monitor it, the more you can start to say things, oh look, I'm just noticing I'm comparing. So by labeling the process, hopefully you can also step back and start to understand that this is part of the process of being preoccupied with your appearance that we call BDD. And that feeds into a bit of the idea of trying to build more confidence in what in therapy we call theory B, the idea that where theory A is you've got a problem with your appearance, but theory B is the definition that you have a worry or preoccupation problem about your appearance. And so by really seeing this process of comparing and understanding when it happens, where it happens, with whom, how often, you started to really define a component of your BDD. So it stops becoming this abstract thing of a diagnosis, and you're really locking into understanding a process, and you can quantify that process. You can really see one of the mechanisms that is maintaining the problem.
Next one.
Please, David. Thank you. So we want to understand your own beliefs and motivations behind comparing. David's already given you some examples of those motivations. And remember, the brain is usually trying to keep us safe. People don't develop problems like body dysmorphic disorder because your brain is necessarily in any way faulty. It's usually that your brain is trying too hard to keep you safe in some way. So trying to understand your mind's intention, what is your brain doing when it's comparing? Is it trying to help you to understand, as David's pointed out, kind of where you sit in a sort of social hierarchy, and therefore you don't step out of your place and run the risk of being ridiculed or rejected? Is it about trying to keep yourself conscious of how you feel you look, so you don't forget about it and then be caught off guard by suddenly realizing that you're unattractive in your own mind? Or is it, again, as David said, about trying to assess and try and work out just how bad do I look, how exactly do I look, what areas of my appearance would I have corrected if I could have a cosmetic or dermatological procedure, these kinds of things. So it might be analytical, but again, you've got to understand your brain is trying to solve what it believes is a problem. So trying to understand and take a sort of sympathetic view of those motivations. And one way of understanding those motivations can be to say, well, if I stopped, is there anything I'd be afraid would happen? Would it be that I'm afraid I'll get a lot of people worry behind BDD that might become maybe too complacent about their appearance, and that then might mean that they'll become more vulnerable to ridicule or rejection or something. So really try and drill into what's my brain trying to achieve. So what's what we call the intended consequences of comparing, and then it can also be really helpful to try and identify what the unintended consequences are. And again, and David has already identified some of those, such as what's the cost of comparing? It might be that it's increasing my preoccupation, which is just, it's generally feeding into how many hours and minutes a day I'm spending worrying about my appearance. And that therefore means my brain is overloaded about appearance and I'm having a real hard time being objective about the way I look because I'm spending so much time thinking about it. It might be more specific that if I go looking for trouble, if I'm constantly comparing my appearance against other people, I'm bound to find flaws and discrepancies because I'm scanning and looking for this. So it's going to really sharpen my focus on any flaws that I believe I might have. It might be that, again, that I'm distracted and not really fully engaged in the social interaction. And therefore I get the impression that people don't find me attractive so much in a kind of dating context. And I assume that's because it's how I look, but it might in fact be because I'm a bit distracted and I'm not at ease, and comparing is one of the things that's kind of keeping me in a discomforted social kind of mode. And that in itself might not be helping me get along with people so well. So the potential consequences are endless, but it's really important to think through for yourself. Why is my brain making this step of comparing, and what's it trying to achieve? But second to that, what are the unintended consequences? What are the costs? Because stopping comparing is very difficult. So you need as much as you can to try and really reinforce that motivation to stop it. And other questions that can be really helpful to ask are things like, what would you advise someone you care about regarding compare about your appearance? Would you recommend comparing to someone that you love? Even if you wouldn't recommend comparing to someone that you care about, why wouldn't you? Would it be that you'd actually flag up some concerns about what that might do to person's, for example, self-consciousness? If you're in a social situation, you're comparing yourself against others, you probably would flag up that it's like to make you feel a bit awkward and self-conscious. That may not only mean that you don't perform as well in a social situation as you might. We know that if you're self-conscious and self-focused, you're more likely to imagine people are thinking critically of you, which adds to an existing bias in BDD where people are inclined to, say, imagine that people are gazing at them critically and things. So the more self-conscious you are, the more that fuels that tendency to jump to conclusions about people thinking critically. So is comparing really good for you? Is it in your best interest? Or if you can quantify the number of times you compare in a typical day or in a typical week, or the amount of time you spend comparing in a typical day or a typical week, would you, at least if you wouldn't necessarily think you're going to completely stop, would you dial that back? So would you think, if you're, let's imagine that you're comparing, and it's not unusual for people to find that they're comparing more than 100 times a day, would you say, okay, I still think that comparing is a natural part of being a person, but actually I think I'd probably want to scale that back to about maybe 5 times a day. So really understanding, is it good for you, and would you necessarily really want to carry on doing it to the extent that you're doing it? Next slide, please, David. As ever, we want to encourage everybody to work on battling, combating, counteracting their various patterns and behaviors in BDD with compassion. So remember, the heart of compassion is the drive to relieve suffering. And we want to really encourage you to think about this in terms of, I understand that my brain is only trying to keep me safe. This doesn't mean I'm wrong, strange, or my brain is faulty, but it may be, as Paul Gilbert, the originator of compassion focused therapy, would say, that if you don't drive your brain, it'll drive you. And I've often said in the past, that the brain is trying to look after you. It doesn't always necessarily understand quite what its consequences are. So trying to understand that this isn't your fault, but it may not be that helpful to you. And so therefore, let's make a concerted effort for maybe try and think of setting aside a particular period of time that you're going to really do it as a campaign, a plan. You're going to go after comparing, and to really focus on this for a period of time, a few weeks maybe, to really get good at breaking out of the habit of comparing. And I think instead, when I'm, say, within a social situation, or even when I'm watching TV or going through social media, what do I want that experience to be about? What am I going to focus on? Maybe social media could be about learning things and developing and connecting with others. Maybe that's what being out in social situations is about. It's about being connected in the moment. It's about being in the room, about interacting with other people. It's about having an experience, and it's not about comparing and trying to work things out about your appearance, say. But we would definitely say that we know that, like any habit, because the brain is designed to maintain habits, because as I said, it'd be quite awkward if you could easily learn how to forget how to walk. That would be a real nuisance. Or learn how to forget to drive a car easily. That would be a real nuisance. Overcoming habits requires sometimes a surprising amount of time and effort and perseverance. So please see this as being a job that you can make great headway with, but it's going to be sticky. It's going to be sort of stubborn. So we really need you to be patient and persevere with it. Keep using your tally counter to stay on top of your comparing, and hopefully get some really nice feedback and seeing those numbers, that frequency of your comparing coming down. Something I've often found in my clinical work is that you sometimes you always have to think about, you're going to try and disrupt, throw spanners in the work of comparing before you get much progress in really seeing the frequency and duration of your comparing coming down. So you have to try and catch yourself a bit earlier in it. You try and shorten it. You try and distract yourself a bit more. You try and refocus your attention, and you won't necessarily see that you've at the beginning you can stop it, but you can kind of mess with it a bit and shorten it and try and disrupt it, try and stop the process of comparing just replicating itself smoothly each time. And with that kind of mindset that you're going to be a kind of disruptor first and mess with it, then you'll find over time, with a bit of practice, a bit of experimentation of figuring out what works for you in terms of where to refocus your attention, whether it's the extent to which you need to be ready to go into certain situations and really go in. So if you say, I always think about, say if you're going to walk into a restaurant, but you know that a restaurant is a place that you like to compare, it's worth, even before you go into the restaurant, really getting into the groove of focusing your attention on the things you can see around you, the ground underneath your feet, the wind against your skin, the things you can smell, so that you're entering into a cue situation, a triggering situation, really with that mindset locked and loaded, and really planning and preparing and getting into that mindset of, I'm going to really engage my attention into other aspects of the environment, so I'm not comparing so much, and I'm going to really think about, I'm there to connect, or I'm there to have an experience, so that you really get clear in your own mind that that's what you're going to try and do. The comparing is still going to try and happen because it's happening on autopilot, but with practice and perseverance, you're going to get better at refocusing your attention and engaging in these situations in other ways. So sometimes it's helpful. Sorry, Dave, you just got to whack back.
Sorry.
One step. Sorry. So sometimes we find it's helpful for people to practice. If you find it quite difficult to refocus your attention and gain control of that, sometimes it's helpful to start with very low threat situations, like walking around a quiet street that you feel quite safe in, and practicing paying attention to the ground underneath your feet, feeling the wind against your skin, on the sun on your back, practicing paying attention to the smells around you and the things you can hear around you and all the different things you can look at. So you kind of work those attentional muscles in a kind of low threat situation, so you kind of get a sense of what it's like to do what we call situational refocusing. But you get a sense of that in a fairly low threat situation, and then you bring that skill to situations that really trigger off the urge to compare. Thanks, Dave. So keep practicing, because it's going to require quite a lot of practice, because we particularly think about if most people have had BDD for quite a few years before they end up seeking help. So it's going to be a relatively well embedded habit. Keep seeking out a variety of different kinds of situations. One of the things we know these days about facing fears and overcoming compulsions is that can be a bit more effective if you vary situations. So don't just stick with the one or two social situations, for example, that you're practicing, and try and, if you're used to practicing in the supermarket and in the pub, also try to get to a restaurant and to the cinema, or into a different kind of shopping center, or going to a party. Try and gradually and steadily vary your stimulus so your brain gets more and more flexible and gets better at learning how to avoid comparing. Anyone I know, luckily, having been doing this, despite how youthful David and I look, we've both been doing this for a little while now. And so we do now have the benefit of a lot of people having broken free from their BDD and overcome problems like comparing. But anyone that's done it will tell you that the recovery does this. You have your good days and your bad days, and on the road to recovery, you're occasionally going to find that you feel like, oh God, I feel like at one point I was making good headway with this comparing thing, but today I've gone into this situation and for the life of me, I simply can't stop it. But probably the most important thing to remember is knowing that that's completely normal. That bad days, slipbacks and setbacks are just part of the process, and it's about getting back on the horse, carrying on and really persevering. And sometimes you can learn something from those bad moments. Did I get caught out by the idea that it was particularly important to be more aware of my appearance in a certain time and certain place? Did I see somebody that reminded me of someone that triggered me to compare? Was there something about that body part that really caught my eye? So you can plan and prepare to really refocus and resist that in future situations. As I keep saying, keep monitoring the frequency, and so you can help, because it helps you simply by recording the frequency of your comparing, or help you to keep seeing it as a project. It's part of a problem to solve, rather than, and really reinforcing the idea that this is a preoccupation with your appearance problem. It's partly a comparing problem. It isn't an appearance problem. So keep going, keep that frequent recording going, and try and make this, whilst I would say that this is one of those aspects of BDD that can be very important, to give your comparing a chance of really having or your efforts to resist comparing, I should say, to give those a chance to really have a really positive impact on your BDD. It needs to become part of a package of maybe facing other feared and avoided situations, cutting back on other compulsions like camouflaging, concealing, mirror checking, and so on, so that you've got a system that's all moving in the right direction and it's supporting those efforts. And we understand that that's tough, otherwise we wouldn't have a job if it was easy to do, but people do it, and it's really worth doing. So please do stick at it, because you can do it.
Great.
I always like this quote that understanding the problems of comparing is nothing new, because good old Ted Roosevelt said many, many years ago that comparison is a thief of joy. And certainly comparison is a thief of appearance-related joy, without a doubt.
Yes. And that is the end of our presentation.
Should we see if there's any questions?
I think there is. There is I'm not sure whether we go to Q&As or chat, because we've both got questions, I think.
Okay.
Right. Shall I read them out, Rob?
Okay. We'll both have a go.
This is a question from Victoria. Our 16-year-old autistic daughter will repeatedly take photos on a phone of her side profile. She'll then draw over the image the version of her ideal nose and send this altered image to our phones, asking how we can possibly say there's nothing wrong with her current nose. How do we best react to this behaviour without being drawn into protracted conversations about her nose? Wow, that's a really difficult question. So I think what Victoria's identified is comparing, or what her daughter is doing, isn't it, in terms of what her ideal is, and seeking reassurance or wanting her parents to confirm her view of things. And so she's got an ideal about how it should be, and constantly comparing with that ideal, isn't it?
Yeah. And I think the key question, isn't it, is sort of how helpful are you finding this? How much, is to ask your daughter how much is this really helping you? And would she be willing to run an experiment of seeing how maybe a week of doing that strategy compares to a week of perhaps her sending photographs of other kinds, even, and trying to see if we can help her to understand the impact of comparing, and see whether she would be willing to try and do something different for a period of time, and even track what effect that has on her concerns about her appearance. And we're quite keen to try and encourage parents and other loved ones to try and find ways of responding to people's distress, like by giving them a hug or making them a warm drink or something, but not to respond to the content. So another thing might be to say, look, we can see that this photograph means that your BDD is activated and you're upset. How about we try and agree that we'll do something comforting with you, or something that's going to distract you and refocus you, but we don't want to respond to the content of those photographs.
I mean, I agree entirely, Rob. I mean, I think part of the problem here is that this is just a snapshot, isn't it, of her daughter's difficulties, because presumably she is doing this all the time to herself. And it's just what her parents see in a very brief period of time, isn't it? And I suppose what her daughter is really looking for is confirmation, in the sense that, and presumably seeking a cosmetic procedure to get parents to pay for or something to change her nose. And I think, as Rob was saying, the key thing is to try to focus on how distressing it is and being compassionate and caring and understanding, but not discussing the content of the particular question. I mean, obviously, this needs to be done in the round, because a lot of other things need to be going on as well in terms of the full treatment package, trying to help your daughter to engage in treating this as a problem of her body image rather than a problem to do with her nose. Yeah. Oh dear.
I think that's the answer, is that at the end of the day, probably the real answer is to encourage her to engage in a full treatment.
And it might also include medication, all sorts of things as well. Obviously, we're focusing on comparing as one little part of the package today.
Yeah.
Should we go to the next one? Claire, she says, good evening. It's all very new to us as parents of a teenage girl who is struggling with BDD, who she believes is ugly. She compares herself a lot to other people. She struggles to go to school some days and social situations. She's avoided looking in the mirror and avoided reflections for most of this year. She's adamant that she doesn't have BDD and she believes it's just ugliness. And if she had a different face, everything would be okay. Is it normal for young BDD sufferers to accept help and accept they're struggling with BDD? We've been advised not to put pressure on it to have CBT. Would you agree with this? Sorry for the rambling question. No, I don't apologise. I mean, again, the comparing is, just one aspect of the bigger picture. And I think you're right, Claire. I mean, it certainly sounds from what you're saying that your daughter is suffering from BDD. It sounds as if she's very preoccupied and very distressed and really quite increasingly disabled by her symptoms. And I would encourage her to get assessments and understanding and getting help. It's going to be tough, and it may take time to accept that there is a different way of looking at this problem, and there is help out there. So long as we don't treat this as an appearance problem, but we treat this as a body image problem or an emotional problem. Rob, I don't know what more you want to say.
Well, I think it's always, the great joy of mental health is that there's always lots of different opinions, which I know is very tough, both as a patient and as a parent of someone with a problem. But I think our opinion would be, yes, it's really normal that people struggle to accept that they have BDD. But I think we probably disagree a little bit on the idea of putting pressure to have CBT, because I recently encountered a service that has a rule that they don't offer specialist CBT for BDD unless a person's had it for at least 3 years, which to me seems a little bit problematic, because BDD doesn't get better often of its own accord.
Well, definitely.
So
is that a service of the NHS?
We'll talk about it another day.
We'll have to talk about that one.
But I think the point is that there is sometimes, because BDD isn't always taken as seriously as other psychiatric disorders for reasons that drive me absolutely around the bend. There's sometimes a slightly unnecessarily gentle approach to it, for want of a better expression. And I think probably we wouldn't agree to not apply a bit of pressure. Would you say, David?
Yeah, definitely. Yeah. So Victoria's asked, how do you refocus attention when an appearance-related thought has taken over? It is tough, and so I would say it's usually being very self-focused in an internal way. And so the first step is always to become more aware of, how self-focused you are, and the importance of therefore and practicing becoming externally focused on what you can see around you, what you can hear, what you can smell, and so on. And really trying to focus on what's important in your life rather than your appearance.
Yeah, I agree completely. And the no psychological strategy will work brilliantly at all of the time, and sometimes it is really hard when BDD is very, very activated to be able to make those kinds of interventions. So it is worth having locked and loaded a good 3 or 5 different good strategies you've got to try and distract yourself and refocus. But sometimes it might mean that you have to double back and think, okay, next time I go into the situation, what are the thoughts I'm going to expect? So let's do a bit of practice in terms of trying to, Steve Hayes has this idea, the inventor of acceptance commitment therapy, that you write the thoughts you're going to get on a piece of card and stick them in your back pocket, just because it helps you to see them much more as anticipated mental events. And so you can try and change your relationship a bit with the thoughts you're likely to get, but practicing refocusing your attention, really getting good at that skill in perhaps less challenging situations, and then bringing it and practicing it in the more difficult, more activating situations.
Great. So someone else asked, I've recently had 15 therapy sessions with Life Centre. I was reminded at 57, it may always be I'm hypo alert and on freeze mode and will take time for change. My BDD was throughout and began with my abuse 49 years ago. Is recovery possible? Oh, I'm so sorry. Well, definitely recovery is possible. And I think in the context of abuse 49 years ago, it's not surprising how difficult it is to try to help you to emotionally process those experiences and be able to bring them up to date, that it's not happening now. So, you know, I definitely agree that it is possible, but it's going to take time. And it's very tricky sometimes to access those sorts of memories and to develop a different relationship with them. What about you, Rob?
No, I agree, and I think that's absolutely right. And again, we are sorry to hear it, generally, but there are strategies like EMDR, for
Yep.
example, and imagery rescripting that we know we've seen be helpful to people who have got a clear link to trauma underpinning their BDD, and that can add extra value. So there's still every reason to think with the right help that you can improve.
So Olivia has asked, one of my hardest ways of comparing to shift is the dimensional comparison. It goes as far as imagining whether fictional TV characters would want to have a relationship with me. It usually ends up in, they'd think I'd look hideous, but maybe my personality would make up for it. It then shifts to other types of comparing, like temporal and counterfactual. I'm working hard to face this head on, but sometimes I feel discouraged when I think about the many months I spent working on my recovery. This compulsion of comparing especially. Any tips for staying persistent? Oh, I'm sorry, Olivia, this is really tough, and you've done fantastically, I suppose, to label some of these different processes and be able to perhaps stand back and observe what you're doing. I mean, it sounds to me quite a lot of fantasy type ruminating, if only, and then easily going down a rabbit hole of, anticipating what they'd be thinking, and so on. So, this is classic ruminating, and ruminating often, this type of comparing ruminating, often is a way of trying to suppress emotion. So there may be a lot of sadness in there, and hurt and regret. So I would, with your therapist, if you are in therapy, try to really access some of these emotions of what you experience when you are not ruminating, and able to stop the ruminating, really focus on the emotions, because what we do know is that ruminating tends to suppress the emotion. Yeah, and so we need to access that.
It's a really important point that sometimes areas to refocus one's attention upon aren't always pleasant. That sometimes it's as important to try and understand, okay, where in my body do I feel a certain emotion? So to really tune into the experience and processing that feeling. In terms of staying persistent, there's one of the things that works in so many areas of life is to try and find someone to share that with, and to have, so if you're not seeing a therapist, to at least identify a particular friend or family member, or maybe someone else with lived experience of BDD, to really share your efforts and report to, and get a bit of encouragement and support, because it's hard oftentimes doing these things alone. But I like David said, I'm very interested in the way you've started to maybe label these different kinds of comparisons. That again can help take a bit of distance and detach better, and maybe even frequency recall with those different versions, really to reinforce that, and understand that you're not alone, that this is a common part of BDD. It does take sometimes a long time, but each moment of refocusing, each moment of stealing time away for your concerns about your appearance and engaging in other activities will chip away at it. You will get there.
My comparison impacts my perception of femininity. I find myself paralyzed around other women and lack the ability to pull myself out of situations where I'm surrounded by women who have my ideal body type in real time. I don't know how to navigate this. While I'm thinking, Rob, can you have Do you have an immediate thought on that?
Sorry, I was just caught by a different message. I apologise, David. I wasn't paying my attention.
Is somebody who's in on their femininity, I find myself paralyzed around other women and lack the ability to pull myself out of situations where I'm surrounded by women who have my ideal body type in real time. I don't know how to navigate this.
Yeah. So one of the rules in recovery is the bigger the problem, the smaller you need to start. So it might be important to start even by putting 1 or 2 pictures up on your wall in a certain room in your house, so you can practice walking into that situation and trying to refocus your attention and avoid comparing against those photographs. So to try and scale the demand back into a much less intense process, because it might be that it's a bit like kind of mental weightlifting sometimes, that being in a room full of other women and your brain is comparing left, right, and center. It's just too big a demand to stop it at this stage. So the trick often in therapy is in recovery is kind of being creative and trying to scale the exposure back in a way that you can practice and get a sense of not comparing, and then gradually enter into more difficult situations.
Yeah, I mean, and again, I think as we said before, to refocus your attention externally on the whole, not on that specific feature that you're particularly concerned about in terms of the femininity or body shape, because I would then really concentrate, I think, on what you're saying, what the topic of conversation is, and obviously not on the body type, because they're not interested in that. They're interested in what you've got to say.
Yeah, good.
Someone said, I don't believe I have body dysmorphia. I truly believe that I'm ugly. How does one tell the two apart? Well, body dysmorphic disorder consists of a preoccupation with the way you feel about your appearance being ugly. It's usually focused on specific features, and it's extremely distressing and full of shame, and usually interfering in one's life in various ways of to do with perhaps one's work or career or relationships and friendships. So that is body dysmorphic disorder. It's not just a matter of believing you're ugly, and often associated with many repetitive behaviors, particularly checking and comparing and overthinking and avoiding situations and camouflaging. Is that clear about what BDD is?
Yeah, very good.
Next person has said, what if your child is the most stubborn and immovable person on the planet? A 20-year-old male adult child, and refuses to increase medication beyond 50 milligrams of Zoloft, that's sertraline, and does not accept the BD diagnosis. He's on the very severe end of the BD symptoms, and we feel so helpless. We're in the USA. We're advised not to push too much when I'm feeling so desperate. Well, I think I can understand what people are saying to you, because, the more you push, the more someone else is going to resist. This is very common that someone with BDD believes that the problem is their appearance, and they've got to solve an appearance problem. And, we feel for you. But there is no easy answer, but other than by, constantly, regularly motivation, what we call motivational interviewing, that is actually trying to highlight and pull out from an individual some of the unintended consequences and difficulties that perhaps might result from their BDD. I mean, I wouldn't necessarily just push the medication. I think it's more about trying to get them engaged in the therapy as well, and trying to help them to improve the quality of their life and to test out their expectations and so on. And I'm sure you have tried to do this, but there's a limit to how much you can do. You just reach the saturation point, I think.
Yeah, and it's but if you I mean, we could spend without a doubt an entire webinar or so, I think, on this topic. So sorry we can't give a kind of really comprehensive answer, but I think if you talk to many people with lived experience, including people who have recovered, they would say they have had this experience where they've been very close to the idea of BDD being the problem. But over time, particularly if you've got a parent who's still patient and loving and persistent and doesn't get too much compassion fatigue and still flying the flag for that there is more to you than this. And I really think that maybe there are other ways that we could solve this, and why don't we give this a try? Just sometimes just keeping the lamplight burning, trying to keep that hope is in the long term still an important contribution.
Someone's asked, so I truly believe what you say is, I really believe what you say is true, thank you. It's getting the GPs to decide there's help for me. It's so much easier to continue giving me medication rather than sources possible help. Thank you for all you do. Thank you, Michelle. I mean, many places you don't actually need a GP to refer you. And if you look up your search on talking therapies in your local area, then you'll find that most talking therapies do actually allow self-referral. And there should, the talking therapy services do treat BDD in the UK. And, that's certainly the first port of call to get an assessment there. Someone else has asked, do you want to add to that, Rob?
That's great. Thanks, David.
As a young person, I made conclusions that the reason I was being raped was because I was ugly. I had believed this through my life and endured more abuse to support this. I'm not being abused by anyone now, yet my own mind, unfortunately, that is where the question finishes. Yet my own mind. I think it's probably something about your own mind still telling you about how ugly you are, I suspect. And so this is such a sad story. And we can think of actually many other of our patients who've been through similar situations, haven't they, where they've put themselves through abuse and so on because they believe that's all they deserved. And this is what life should consist of. So it sounds to me like, you clearly do still have BDD, and it might well need some more emotional processing of these particular experiences of rape and so on. But it's back to, standard treatment of the BDD in terms of helping you to engage in alternative understanding what the problem is, that this is an emotional problem, a body image problem, and helping you to therefore give up some of your strategies that you're using to keep yourself safe, whether it's the comparing, the overthinking, the checking, the avoiding, the camouflaging, all these things, and perhaps with also the medication. So, there's all sorts of things that can help you in terms of this bully in your head, which is constantly telling you, and trying to therefore develop that sort of compassionate mind in terms of developing an alternative to the bully who's trying to keep you safe.
Absolutely. That's great. That's a lovely answer. Thanks, David. We're out of time, really. We ought to stop.
Indeed. Are you going to rescue us, Kitty?
I don't need to rescue you. You've done a wonderful job. All you need to do is say goodbye to everyone, and I will end the webinar.
Well, thank you so much for everybody who's joined us this evening, and for the questions. That's been really helpful. I know that each question will speak to dozens and dozens of other people who will recognise the stuff you're going through. So thank you very much. And we obviously wish you all well and best of luck with battling and breaking free from BDD.